Hello and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton, and today we're going to talk about vaccinations and why they're so important for our children. My guest is Karen Gangitano of the Health Department. Welcome, Karen.
Hello, thank you.
Let's talk about vaccines in general and why we vaccinate, what life was like before we had these vaccinations for many of the common diseases. Not all, but many.
That's right. So one of the most important things that a parent can do to protect their child against disease is to be vaccinated. Unfortunately, we still have outbreaks of diseases, and like you said, back in the day, there were many children who got sick and died from these diseases, things like diphtheria, and children got polio.
See, I don't even remember diphtheria, but polio, you know, is
That's right. Everyone remembers those pictures of
the
children,
pictures,
iron lungs and things like that.
Right.
And measles was rampant, and mumps. A lot of children got mumps, and we remember getting chicken pox as a kid. And now you rarely see those things because of vaccination. I
think a lot of people, figure, okay, polio and diphtheria, those are kind of gone anyway. I don't stand a great chance my kids getting those. And that mumps, measles, and chickenpox, that's a normal part of childhood, and that they're not serious diseases. But that's not really true.
No, that's not. And those diseases are still around, and outbreaks can happen at any time. Things like pertussis, we've heard of outbreaks of the whooping cough.
Right.
And
that can be really serious. Like, it doesn't sound, a cough, but it's been very serious when there's been an outbreak and it's affected people. And it's a miserable, from what I understand, miserable disease to live through. You are, even if you're going to recover, it's a really rough ride for a kid to have to go through that.
That's right. And so, one thing that might happen if people stop vaccinating their children is these diseases will come back. And so it's very important to stay up to date on their vaccinations so that we prevent outbreaks. There are many vulnerable people in the community, especially babies and young children who haven't had a chance.
Yeah, too young to have had all of their
vaccinations.
Right.
And then you have elderly people whose immune system may not function as well.
And even though theoretically you have this lifelong protection, older people can get reinfected from young people. And, another big concern that I've read is people whose children are undergoing chemo or other things that has really affected their immune system, and they're very vulnerable.
That's right. So and by people being vaccinated around them, we call that community immunity or cocooning effect, so that when those children are vaccinated, and adults too, it protects those vulnerable people as well.
So, and in the health department, you're not a pediatrician, you're not looking at just the health of that one child, because, probably if one child didn't get vaccinated, it wouldn't cause a community health problem. But if 10 children, if 100 children, if a lot of children in a community don't get vaccinated, you look not just at the health. Parents are not just taking a risk for their own child. They're taking a risk for the community and for other people. And you guys are a community health department looking out for all of us.
Right. And that's our primary focus, is to prevent disease.
Right. And, of course, it does help that one child as well, but it helps the community.
That's right.
So what are the immunizations? What is the schedule? What do we need? There's a lot. It's overwhelming when you have a new baby.
That's right.
To think about all these things, the costs. How do you go about with an immunization schedule these days?
Okay, so immunizations start at birth. Babies actually get a hepatitis B shot the day they're born. And then they follow a regular schedule, 2 months old, 4 months old, 6 months old, and then 12 to 15 months of age, you get certain vaccinations. That's the primary series. So things like diphtheria, tetanus, pertussis, hepatitis B, Haemophilus influenza B, those things. And when you turn 1, you get measles, mumps, rubella, chickenpox. So then the next set of shots is for school entry, so at 4 years old.
And that's what we really have to focus on at this time of year.
That's right.
Is making sure our kids are ready for school. They don't get turned away because either they haven't had the shots or you didn't bring the authorizations, you didn't bring the proof of shots, because those kids are going to be in school with a whole lot of other kids. And if you have kids who are vulnerable, if you have kids who aren't vaccinated, there's laws about that, and it's for our protection of all of our children.
The state mandates that children are vaccinated against certain diseases before they enter kindergarten. It's also important if you're in Head Start, there are vaccinations that are required, as well as daycare situations.
Right.
But for school entry, the booster vaccines for diphtheria, tetanus, pertussis, polio, measles, mumps, rubella, and chickenpox are all required for school.
Big series. How does a 5-year-old or a 4-year-old, entering preschool handle that? Hopefully you haven't put it off until the last minute, right?
And they do very well. And some of these vaccines are combined. Some of the things are combined into one, so they may get 2 or 3 shots at that time. But it is important to know that if you don't have these immunizations, they may be turned away from school. In fact, you'll be called to come get your child, and there's nothing more sad than a little kindergartner who has her brand new backpack and school outfit, and she gets turned away, or he gets turned away from school. They're so sad.
Yeah, and now most people with private insurance and their own pediatrician have those regular appointments and have kept up with it, but there may be people who don't have that, don't have good insurance, don't have that. How can they get these required immunizations?
So you can go to any health department. You don't have to necessarily go to the one in your locality, but any health department will provide the children's vaccinations. And in Virginia, all vaccines that are required for school are free. There's no charge for those things.
And that's a pretty darn good deal, right?
Yes.
And tell us where the health department is in Hampton. And again, if you work in Newport News, you're right. Or if you're, in that part of town and it's easier to get to Newport News, you could go to that one. So where are we?
So the Hampton Health Department is at 3130 Victoria Boulevard. And that is on the corner of Algonquin and Victoria, right next to Andrews School.
Right next to Hunter B. Andrews, and the HRT bus kind of thing is on the other side, so you can find it. And do we need appointments to come and do this? How does it work?
So it's a walk-in clinic. You don't have to have an appointment. We are open Monday through Friday every single day. On Mondays, we're open in the afternoon from 1 to 3:30. And then Tuesday through Friday, they're open in the afternoon, the mornings as well, 8:30 to 11, 8 to 11:30, and 1 to 3:30 in the afternoon.
Now, what are some of the reasons that parents maybe don't vaccinate their children?
There's a few reasons. One of them is being afraid of the cost. So parents may hesitate to come in thinking that they are going to incur a fee, which there is not a fee for that. And sometimes you just get busy during the summer. Taking your child to get their shot is not always the most pleasant thing, so you tend to put those things off. And some parents just don't realize that they need the shots, and they go and register for their child, and the school may tell them these shots are required.
And there are people with philosophical objections to shots. They believe there's a link to autism has been, in the news a lot. But that's been studied now for quite some time. And tell us what the scientific evidence is on that.
So there have been many, many studies with thousands and thousands of children to study any links between autism and vaccination, and they have not found any links between the two. In fact, children who are not vaccinated are found to have rates of autism in the same numbers as children who are vaccinated. So they have not found any links at all.
So I think that was, it kind of happens around the same time, and when autism develops is very similar to when that shot schedule is. And
That's
so
right.
people put two unrelated things together in their minds.
That's true.
And it is important that we studied it, but you really want to reassure people that that is not the case. So what happens if my child is due to start school and I haven't had the full on-time vaccination schedule? Is there a catch-up schedule? I mean, would you advise parents who maybe have put it off either for philosophical objections or because they just couldn't get it together and just haven't kept up like they should?
It's very important to bring your child's shot record so that the nurse or the doctor can examine it and determine what's needed. And it depends on how many vaccines they've had in the past, and there is a catch-up schedule, so it's not any problem, and we'll give your child the shots that are required for school that day, and then we'll put you on a schedule to return to catch up, and they will be allowed to enter school.
That's good. And again, free. That's
Free.
a huge,
That's
huge
right.
thing. I think people are worried. I mean, medical costs are very high, and if you're uninsured or not fully insured, to know that the health department can do this, will do this, does this all the time. There's not a stigma attached. It's not a problem. Anyone can come in and get their child's required shots from you all.
That's right. And I also wanted to mention that the next time that a vaccine is required for school is before 6th grade.
That's a big one people forget. You
That's
think,
right.
oh, I got through kindergarten, everything's done, boom, we're great. But no, there is that middle school. And
you may have heard of the
graders.
6th grade shot. Everyone comes in saying, I need the 6th grade shot. And that is the tetanus, diphtheria, and pertussis vaccine, Tdap vaccine. You have to have that to get into the 6th grade. Some schools won't even let you have your class schedule without getting the Tdap first.
Wow.
So, yes.
Wow. That is, and as a parent, when your kid's entering 6th grade, your mind is kind of on other things. And it's an easy one to forget. So I'm glad that you reminded us of that. Anything else?
I also wanted to mention that even though there are shots that are required, there are other vaccines that are recommended for each age group. So it's important, to learn about those things and make sure you keep your appointments with your doctor for their well-child checkups, because as well as getting their vaccines, they're also being examined for their growth and development and to make sure they're hitting their milestones and their health. And the doctor provides lots of education, so we want to make sure children are still having a medical home, somewhere they can go for health reasons.
And hopefully people have that now. I think that health insurance is a little more widespread, a little more affordable, at least in some instances. The health department is a backup in a lot of cases, especially with the immunizations. We need to address these things early and work on prevention, detection, all that sort of thing.
That's right. And come early, come now. As you get closer to back to school time,
The wait time will be longer.
We get a lot of people that need vaccines, children needing vaccines for school, so it's very busy and you can expect a little bit longer wait time. But there are things that you can do to help the visit go more smoothly, which is bring your vaccine, your shot record.
And that's hard, for people who are transient or haven't used, I didn't get a copy of my kids because a pediatrician had it. You just don't necessarily keep all those things. And that's also
right.
true for parents whose kids are fully vaccinated but who haven't gone and gotten the copy of the paperwork from the doctor yet. You want to make
right.
sure you have that.
Absolutely. It's very important to have that. We can try to get some shot records. It takes a little bit longer if you have to try to obtain the shot record, but we certainly can help the parent. The best place to get your shot record is from your pediatrician. And then we have a registry in Virginia, so if your doctor participates, then a lot of the vaccines are in the registry, so we can try to look them up.
Oh, that's helpful. Because
then,
people don't stay in one place and one doctor anymore.
No, they don't. And also, if you do have insurance, bring your insurance information with you. That's helpful. And bring something to help comfort your child.
Comfort after, but also something for them to do if they're waiting.
Right. So a
It's always
favorite
important.
toy or a favorite blanket or book
to read,
is very
anything.
helpful. Try to prepare your child so that they know what's going to happen. If they ask you if it's going to hurt, just explain to the child, well, you may feel like a little pinch or maybe a little sting, but it doesn't last. Mom and Dad are going to be right there with you. Try not to tell scary stories. Middle
Some
schoolers
parents do that.
I know, and
I was surprised that was kind of a thing.
and children get very anxious when they have to get a shot, especially the middle school kids, and they tease one another. and share scary stories. But when they come in and they get that Tdap and they say, oh, that was it, I was so worried about that. And being calm and the parent being calm will help, and explaining to the child, this is for your health, is helpful.
Well, thank you very much, Karen. I appreciate it.
You're welcome.
And thank you for watching. I hope if you have a young one who's starting school, and don't forget also starting middle school, that there is a series of immunizations. It helps protect your child. It helps protect their younger siblings who may not have had a chance to have a full set of immunizations, and it affects the children that they interact with and the older adults that they may interact with. So it is a personal issue and a community issue, and you can't start school without that set of immunizations. So if you haven't had them yet, get to the health department quickly or contact your pediatrician. Thanks for watching.